What is bipolar disorder? Bipolar disorder is a mental illness characterized by extreme mood swings, including episodes of mania, elevated mood, euphoria, depression, or a low mood. People with bipolar disorder may also have changes in energy, activity levels, and thinking. People with bipolar disorder may experience these cycles repeatedly for many years. What causes bipolar disorder? There is no one cause for bipolar disorder, but there are many possible factors that can contribute to its development. Some of the most common causes of bipolar disorder include genetics, brain chemistry abnormalities, life stressors, and traumatic experiences. 1. Genetic factors. Studies suggest that about 60% of people with bipolar disorder have a family history of the disorder, and about 70% of people who are diagnosed with bipolar disorder have experienced a major depressive episode before their diagnosis of bipolar disorder. Some other key genetic factors that may contribute to bipolar disorder include variations in the serotonin receptor genes, which may increase the risk of developing the condition, and variations in the dopamine receptor genes, which can lead to an increased sensitivity to dopamine, a chemical messenger that is associated with pleasure and reward. 2. Environmental factors. While the cause of bipolar disorder is unknown, there are many possible environmental factors that can contribute. These include lifestyle choices, traumatic experiences, and substance abuse. Additionally, people who engage in high-risk behaviors, such as drinking alcohol excessively or using drugs, are also at increased risk for developing bipolar disorder. Lifestyle choices such as diet and exercise play an important role in the development of bipolar disorder. People who have a history of obesity or poor nutrition are more likely to develop the condition. What are the symptoms of bipolar disorder? Bipolar disorder is characterized by extreme mood swings, including feelings of mania and depression. The following are some of the most common symptoms of bipolar disorder. 1. Hallucinations and delusions are common in people with bipolar disorder. They may see or hear things that aren't really there or believe strange things that are true. 2. People with bipolar disorder may have a hard time concentrating or making decisions. They may also become restless and impulsive, which can lead to problems like substance abuse and reckless behavior. 3. People with bipolar disorder often experience extreme changes in weight, appetite, and sex drive. This can make it difficult to maintain a healthy lifestyle and can lead to additional health problems down the line. 4. People with bipolar disorder may have a lot of trouble sleeping. They can often have restless or agitated dreams or sleep too much during the day. 5. People with bipolar disorder may have trouble getting through life or maintaining a job. This may lead to financial problems and isolation. 6. People with bipolar disorder may experience mood swings and feel very happy one moment, then very sad the next. What are the types of bipolar disorder? There are many different types of bipolar disorder, each with its own distinctive features. Some people experience only one type of bipolar disorder, while others experience a mix of different types. Here are the 4 main types of bipolar disorder. 1. Bipolar I disorder. This is the most severe form of bipolar disorder and includes episodes of mania and depression. People with this type of bipolar disorder often have a very high level of energy and enthusiasm, as well as extreme mood swings. They may become extremely irritable or agitated and engage in reckless behavior. 2. Bipolar II disorder. People with this type of bipolar disorder experience episodes of mania and depression, but their moods don't swing as severely as those with bipolar I disorder. 3. Cyclothymic disorder is a form of bipolar disorder that is less severe than full-blown mania or depression. People with cyclothymia have milder mood swings that alternate between high and low points, but they do not experience the full-blown mania or depression associated with bipolar disorder. 4. Other specified bipolar and related disorder. This diagnosis is given to individuals who do not meet all the criteria for bipolar I, bipolar II, or cyclothymia, but who experience symptoms that are related to bipolar disorder. What can help prevent bipolar disorder? There is no unsure way to prevent bipolar disorder, but there are some things you can do to lower your risk. 1. Talk about your feelings with friends and family members. 2. Get regular checkups for physical health. 3. Avoid drugs, alcohol, and other substances that can trigger mood swings. 4. Exercise regularly. 5. And most importantly, stay positive and hopeful. How is bipolar disorder tested? Doctors usually diagnose bipolar disorder after ruling out other possible causes. There are several tests that can help doctors determine if a person has bipolar disorder. The most common tests include the Mini International Neuropsychiatric Interview, the Hamilton Depression Rating Scale, and the Young Mania Rating Scale. How is bipolar disorder treated? Bipolar disorder is a serious mental illness that causes unpredictable mood swings. Treatment for bipolar disorder typically includes medication and therapy. Whichever treatment option you choose, it's important to be consistent with it and to keep up your therapy sessions as prescribed by your doctor. Therapists may use a variety of techniques, including cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and family counseling. Some patients find that one type of therapy is more effective than others, but all therapies can play an important role in managing bipolar disorder. There are several different types of medications used to treat bipolar disorder. Some people take lithium or valproate to control their mood swings. Other people take antipsychotic medications to reduce their symptoms of psychosis. Some people use both types of medications. Medication can be helpful for controlling symptoms, but it doesn't always work well enough to cure bipolar disorder. In conclusion, bipolar disorder is a serious mental illness that should not be taken lightly. It can cause a person to experience extreme mood swings, which can lead to ruined relationships, lost jobs, and even suicide. If you or someone you know is suffering from bipolar disorder, please seek help. There are many resources available, and with the right treatment and support, people with bipolar disorder can lead healthy and productive lives. If you enjoyed this video, please like, subscribe, and share for more videos like this.